Hi, my name is Lindsay. I'll be your nurse today. Can I get you to verify your name and age?
My name is Jude and I'm 9 years old.
All right, thank you, Jude. I show you're here for a peripheral, vascular, and cardiac assessment. So we'll be looking at your blood flow in your arms and legs and checking out your heart today. Is that okay?
Yes.
Any questions?
No.
Okay, as we go, I'll explain everything and you can ask me questions if you have them. So I'm going to start with looking at your arms. So they are warm, dry, your hair distribution is even, and arms are symmetrical. I'm going to check your capillary refill. That just means how fast your blood gets to your fingers. So that looks good. Let's check this side. Less than 3 seconds on both sides. I'm checking your skin turgor to make sure it is elastic appropriate, and it is. Let me go ahead and get you to squeeze both of my fingers. This is just checking how strong your arms are. Good. And I'm going to check your pulses. And this is your radial pulse. Very good. Nice, strong, even. And your brachial pulse. Nice, strong, and even. Relax your arms down and just sit up nice and straight. Straighten your back and your neck. Okay, I am inspecting your carotid arteries, which are here in your neck. They, no bruises, lumps, bumps noted, and no pulsations noted. So I'm going to have you turn your neck and I'm going to palpate in 3 places. Very good. Other side. I'm doing one at a time. That way I don't cut off the blood flow. All right. Now I'm going to do the same thing. 3 places on each side to listen to your carotid arteries. I'm going to use the small side of my stethoscope. This is called the bell. So turn your head towards that wall. Take in a deep breath, let it out, and hold your breath. Breathe. Very good. No murmur or thrill noted. Turn your head this way. Deep breathe in, breathe out, and hold it. Very good. You can breathe. No murmur or thrill noted. Okay, now I'm going to look at your chest, or listen to your chest. I'm going to tell you where I'm at and what we're listening for. So we're going to do it 2 times with the bell and then with the diaphragm. So sit up nice and straight, put your arms down by your side, and back straight. Good. We're going to go to the second intercostal space on the right side. And we're listening for the aortic area. We're going to switch straight across, left side, second intercostal space for the pulmonic. And we're going to go down to the left sternal border, fourth intercostal space for your tricuspid area. And, I'm sorry, that's Erb's point into the fifth intercostal space. Left sternal border is going to be your tricuspid area. Now, mid-clavicular, 5th intercostal space is your mitral area. Everything sounds good. We're going to listen again. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And the mitral area is also where I listen to your apical pulse. And S3, S4 sounds were heard. It's just part of your heart sounds. It's normal. That's good. Now let me get you to go ahead and lay down on your back. Turn your head this way. We're just looking for jugular vein distension. None noted. Other side, please. And same thing, jugular vein distension, that's what we're looking for. None noted, no pulsations noted either. You can relax. I'm going to palpate your pericardium area, and so it's just in the same places as before. I'm just checking to see if there's any tenderness, lumps, bumps, bruises. So aortic, pulmonic, Erb's point, tricuspid, mitral. All right, any tenderness there?
No, ma'am.
Okay. No lumps, bumps, bruises, pulsations noted. And now I'm just going to listen again with both sides of my stethoscope. So I'm going to start with the bell. Or I'm sorry, I'm going to start with the diaphragm. We have the aortic, pulmonic, Erb's point, tricuspid, mitral. Okay, everything sounded good there. No murmur or thrills noted. And same thing with the other side of my stethoscope, the bell. We have aortic, pulmonic, Erb's point, tricuspid, and mitral area. I'm going to get you to roll towards me. On your left lateral side here, we can hear the mitral valve, and that is good. No murmur or thrill noted. Okay, now I'm going to move down to the vascular assessment of your lower legs. So first I'm inspecting, no lumps, bumps, bruises, pulsations noted. Now I'm feeling for warmth and dryness, which it is. And we're checking for edema or swelling. None noted. Now I'm gonna look at the hair distribution. Varicose veins are not noted. Hair distribution is even. I'm going to check your femoral arteries now, the pulses. So these are even and strong. Behind your knee, we have the popliteal arteries, and they are even and strong. Now we're going to go inside of your ankles to feel the posterior tibial pulses, and those are even and strong. And now the top of your foot for the dorsalis pedis, and that is good. Go ahead and sit up for me. Any questions?
No, ma'am.
All right, thank you. You have a good day. I had a 9-year-old male in today for a cardiac and peripheral vascular assessment. We started with upper extremities, looked at his arms. They were symmetrical bilaterally. His hair distribution was even on both arms. Skin warm, dry. His capillary refill was less than 3 seconds. Skin turgor was elastic bilaterally. No lumps, bumps, bruises, or pulsations noted. I checked his radial pulse and brachial pulse. They were strong, even bilaterally. And then I moved to the carotid arteries. They were inspected, no lumps, bumps, bruises, or pulsations noted. I palpated them, and they were strong, even bilaterally. And his carotid pulses were auscultated, and they were even, no murmurs or thrills noted. Then I moved to his cardiac assessment. We assessed auscultated the aortic, pulmonic, Erb's point, tricuspid, and mitral areas with him sitting and lying. There were no murmurs or thrills noted. I used the bell and the diaphragm, both sitting and lying, to do the assessment. I also palpated with him lying at the aortic, pulmonic, Erb's point, tricuspid, and mitral areas. No lumps, bumps, bruises, or pulsations noted. Patient denied any tenderness. With him lying, I also checked the mitral valve when he was in a left lateral position at the midclavicular line, fifth intercostal space. There were no murmurs or thrills noted. At the same area, while he was lying on his back, his apical pulse was noted with S3, S4 sounds heard. And then we moved, I also checked with him lying on his back, his jugular veins. There was no distension noted, no pulsations noted. We moved to his lower extremities. Both legs were symmetrical. Bilaterally, there was no edema, varicose veins noted. Hair distribution is even, skin warm, dry, and we checked his pulses at the femoral, popliteal, posterior tibial, and dorsalis pedis, and they were strong and even.